Morning, guys. Well, today we're gonna geld Trapper John. Dr.Torvik's here to do it, and then he's gonna spend the majority of the day in a pen just right next to where he is, but by himself. So, well, I figured out what's up. Anyways, we'll get him caught and all that, and bring you guys along. Alrighty, we got Trapper John caught. He's gonna spend the day, maybe the night, in this pen here. So we're just gonna geld him right here in this pen. It's kind of clean ground right here. The horses that stay in this pen like to use the bathroom over there, so this is pretty good ground right here. I'm gonna move this trough to the side of the pen and move this. Hey, pay attention. Move the salt block out of the way. That way, when he lays down, hopefully he don't lay on it. Trapper wants to go see the vet trek here. He's really curious. There's Hot Lips. And there's Thule, that's Mom.
Bud, you ready for a life-changing experience? Your brain surgery? Hi, kiddo. You're getting so big. You're getting so big.
Big and gentle.
He's like, something's up. My heart rate is up.
Hello? I'm awake. It's the second time in my life I've ever been awake.
Have you felt to see if there are both testicles there, or will he let you?
He'll let you, but I never have.
Well, my hands are freezing cold, so
He's got hair.
I'll sedate him first.
Oh. My hands aren't cold.
He might not like it.
My hands aren't cold, but I'll wait till you're not listening to him.
Your daughter was screaming. I could hear her from the truck.
I'm sure she's mad.
She's mad. I saw Bailey go in. I'll get her from this side. You get her from that side. Ain't really on her, but it's cold out.
I got. Okay, fine.
You're fine. We'll sedate you, buddy.
Yeah. He says, "Hey, that was kind of personal, guys." Sorry, Trav. With these half drafts, I've found that they're kind of lightweights when it comes to the sedation.
Good boy, buddy.
You can just show Rush a sedation needle and he's sedated.
Oh, that's the good tequila.
That'll keep him on his feet or will he go down?
No, that's not the drop down. That'll just, that'll just kind of relax him a little bit.
That'll make you feel like you're gonna feel for the rest of your life. Rush had tiny testicles.
They're tiny. Well, I feel long for sure. I think it's there, but it's high.
Too high?
But it's high. I'm pretty sure I can feel it. Just in the inguinal ring. I think I'll be able to get it.
Knock him down and make sure we can get it before we cut him?
Yep.
Perfect.
So for, hey bud. So for castration, we have to make sure that both testicles are there.
Okay.
Because otherwise, sometimes in these stud horses, we can have one that's up and retained in the inguinal canal or up in the abdomen. So we always check them before we knock them down. He has one for sure. The other one I think is there.
Okay.
But I think it's high. So we're going to lay him down and check and make sure that it's there before we cut anything.
Perfect.
Because if it is up in the abdomen, you got to go to a surgical facility for that.
Gotcha.
Just for cleanliness.
Gotcha.
All right. I'll give him some butte first. Can we turn him that way? Just fit.
We absolutely can. It's actually better to clean. He says, "Wow, my feet are heavy, guys, but I'm floating at the same time." You can stand like right here to Get the good shots, Matt. If you need his head in a different position, let me know.
No, I don't think so. Okay, this is just the butte. This is not the knockdown.
Butte's the painkiller.
Pain, yep. Butte is for pain and inflammation.
Long acting or?
Yeah, 12 hours.
12 hours.
This is the knockdown juice.
Okay. Once he starts to wobble, push him backwards a bit.
Push him back, but not over backwards. Hopefully he'll just kind of guide down nicely.
This is the scariest part of the whole thing.
It is the scariest part. It's the most dangerous part, that and getting up.
Do you want to drive?
I'll just kind of hold here, you hold the other side, and we'll push him back.
Say when.
He'll say when. I didn't grab a rope, Bailey. It was like wobbly. And then start pushing. Let me get a towel. You have the towel, I got the towel.
Big Brother and Henry are concerned.
What the heck?
You dropped one, Lena. Dropped two.
Dropping everything.
And I wish we could spin him. Do you want to spin him so he's in the light?
No.
It's okay.
Okay.
Tie that or just hold it.
Just hold it.
Just try and narrate what you're doing if you can think about it, Lena.
Right now, I'm just trying to make sure we have 2 testicles. I'm still only feeling one. So I'm just pushing on the inguinal canal. Can we go, just like roll up a little bit?
The whole thing or just his body?
His whole body. Just kind of on his back a little bit. I'm just still trying to find that second one. Got one for sure there.
Yeah, they're annoying.
Yeah.
Anytime we're in our yard, they bark.
I do think it's there. I'm gonna have to shave him.
Okay.
He's pretty hairy. That lidocaine?
Okay, so Lena found it.
Yeah, it's just tiny and it's up high. So we're gonna scrub and get ready. I'll give him some lidocaine to block them so that way he doesn't feel too much, and then we'll rock and roll.
That's good because to go to a surgical center would have cost a lot of money.
A lot of money.
We might have had Trapper John the stud horse.
Yeah. Well, you wouldn't want to breed.
Lena's just giving him
Give
the
him a
blocker.
block so he can't feel it. All right, go ahead and do another little scrubby scrub.
This isn't like a sleep anesthesia,
No,
right?
he's just, well, he's knocked out, but it's short-acting anesthesia.
Okay.
He can still feel a little bit. So now I'm just getting my stuff ready, getting my sterile gloves on.
You gonna tilt this anything?
Not yet. Bailey will probably switch you here in a minute. So she can hand me stuff. Not switch you, but she'll hand me stuff.
Perfect. He's so concerned.
He's like, I went through this. Support for his brother.
Yeah.
All right, scalpel, please. Then I will need the castration pack open next. Cutting. So I'm just making an incision over the area that I blocked to get the testicle out. And I pop the testicle out. Go ahead and open it right there. Grab it with some towel clamps so it can't get away from me. Okay, I'm gonna need emasculators if you want to start getting them ready. So this hole right here is the testicle. And we're gonna clamp it and cut the blood supply off to it and then cut it off. Can you open that, please? Thank you.
How long do you leave it clamped for?
7 minutes. Or as long as the horse will stay down.
Whichever comes first.
Yep.
He'll probably stay down being a half draft.
Probably about 10 to 20 minutes longer than we need, hopefully.
Yeah. When Dr. Cockrell cut Rush, he took a long nap. She was getting a little bit concerned she was going to have to wake him up.
He just liked his drugs.
He enjoyed the trip, you betcha.
Half drafts do tend to be lightweights. Okay, now I need you to pull that leg up.
If you need more, let me know.
I just need to be able to feel that other one. Actually, I'm gonna ligate this one so that way I can let it go and get it out of my way. Don't have... So what I do is I go in and I use suture and I ligate it, just because we don't want it to bleed excessively. It's not necessary.
What does ligate mean?
Ligate means to cut off, to make, put a suture around the blood vessel so they don't bleed.
Okay.
I do it because I like to sleep at night and not worry about them.
Yes.
Brothers are so concerned for him.
Mm-hmm. And Luke, he don't care at all. He figures it's one less body at the hay bale.
He's like, I get more hay this way.
Yep. He's doing good. I can hear him breathing.
Not pulling on you.
No.
That's what I need to know, is if he's starting to pull on you.
Yeah.
Is it complainer?
Yeah.
So because you tied it off, you don't have to leave it
Yeah.
clamped as long?
Nope, because it's not bleeding. Usually we let him sit for 7 minutes. But it was in my way of finding the other one, which went hiding again.
The Sports Center update.
Pretty much. Okay, can you roll him up a little more?
Yeah, grab that stuff.
Oh, hold on. Hold on, right there.
The bleed.
I need this guy. So, don't usually have to dig around as much, but this guy's testicle does not want to cooperate. Okay, now scalpel blade. Is that him pulling, or?
No. That's me being a weenie.
You're not allowed to be a weenie.
No, no.
So huge testicle difference.
Is it abnormal?
A little bit. I'm trying to.
Oh, wow.
Yeah, that's a testicle. It's much tinier.
Yeah.
Does that mean anything in particular?
Just, I mean, they always have one a little smaller than the other, but this one's tiny, tiny. It's just not well endowed.
Poor trapper. Neither was Rush.
So we can, when we are all done, we can show you the testicle differences.
Cool. I don't think Trapper wants to see him.
Okay. I'm ready for that clamp again. Should have shaved you a little more, buddy. You're hairy.
Not the same one.
Yeah, same one's fine. So that right there is the testicle. That's why I had a hard time feeling it, because it's tiny.
You're not the only one getting thrown up loose, Matt.
You know.
Okay, making sure I have all the testicle and epididymis in there, which is just the base of the testicle. So a lot of times when people say proud cut, they think it's because part of the testicle has been left behind, and it's the epididymis that they worry about. But actually, proud cut just means that they were cut really late.
And the epididymis will make them.
It stores the sperm.
It'll okay.
But it has a little bit of testosterone,
I was gonna say it'll make them act and look a little bit
Yeah,
studly if
it
it's
will.
left.
which that's the whole epididymis right there. So we got all of it.
Okay.
Clamps on.
Jesus, Rush, a newborn calf has bigger testicles.
Yeah, where'd the other one go? Yeah. So a lot smaller. Much smaller testicle than the other one. Let that sit.
I'll let his leg down.
Let me ligate him real fast.
Okay.
And now he's no longer a stud horse.
Nope. Trapper's on the gelding.
You'll be happier, buddy. Geldings tend to have happier lives. I did put a skin. How's he doing?
He's good. He's grunty. He hasn't pulled or anything.
Actually, not like 8 just yet. I have some skin. So I'm just going to let this one sit for 7 minutes just to hold, because I caught a little skin in it, which is not ideal, but it happens. I can't get around it, but it looks good. It's not bleeding. Do you have a timer going?
Yeah, let's go.
Okay, you can let him down now.
Okay, I'm gonna grab your phone so it don't fall. All the way, or?
Just resting.
Okay.
See the difference? There's actually not that much. It just was way up there.
Yeah, just like Rush.
They don't have to be big. Get the job done.
Nope. We want to pick those up so Ollie don't come find them.
Yeah. They got lidocaine in them. He wouldn't appreciate that.
He'd have
He'd have a numb mouth.
a numb mouth. Because he knows what's...
He's like, I know what this is.
Yeah, you're not going to get these ones, Bubba. It don't work that way.
Sorry, bud.
He's like, would it be numb while I was eating them or just after?
Just after.
As long as I could taste them, it'd be worth it. I know, the joke's at your expense.
Can you fix his front leg for me? Just straighten that bottom one out underneath. Yeah, so they're not directly one on top of the other. Thank you. They lay down too long, or if they are lay directly on the nerve, they can get some leg paralysis.
Huh.
So a lot of times we want to stretch their legs out so they're not one on top of the other.
Interesting. Did not know that.
So just give him a little bit of penicillin. You're going to see his muscle jump a little bit. That's pretty normal, but we always draw back to make sure there's no blood first.
You don't want to give penicillin.
You don't want to give penicillin in a vessel. I think we got it. So this is just an antibiotic to help protect him. And then we're going to need a vaccine.
Okay.
1 mil.
Please. Are you still rolling?
The 5-way has the tetanus in it.
Yeah, so since this colt's never had a tetanus vaccine, we're going to give him a vaccine for it. Because whenever we have an open wound, it's a good way for them to contract tetanus. And tetanus can be very bad in horses. They're very susceptible to it.
And the yearly vaccines you do in the spring every year have that, correct?
Yes. So it just depends on when they received it. Usually we like to give him it in the spring, but if he's never received it, we'll booster him in
Yeah, we
a
did.
month. I
We
was going to
did
say, he
give-
was too young, I think.
Yep.
He was a newborn. Oh, man. And then this is his vaccine. And I'm just...
Does it have to go by the area? Does that matter?
No, not at all.
It's just an easy,
This
clean
just-
spot.
We're back here already,
Ollie, out.
and it just has to go in the muscle. Almost there to take that clamp off.
I think Rush was,
He was older.
he was older.
He's a year. It's better to do them when they're really young.
Yeah.
They heal faster.
Yeah.
The blood supply isn't as big. The nerve supply isn't as big.
Yeah, that was a management fault on my part for that
Yeah,
one.
it happens.
Yeah.
Sometimes you just have to do it when you can.
I appreciate doing them much smaller because
Yeah.
they're easy to go
It's
up and
easy,
down.
Yeah, up and down. Hi, Rush.
You're probably good. I'm gonna take this clamp off. go ahead and lift him up. I'm gonna see how we're doing. So it's been 7 minutes. We're taking the clamp off, and then I watch it for bleeding. Little bit of bleeding is okay. You just want to see, you don't want to see continuous bleeding. And then I always come back in here and I stretch this open, so that way we have a good area for drainage. Because if it doesn't drain, then you're going to get infection, serous cord, a ton of swelling. So the best thing is to keep that open. There you go. You have a gelding.
Perfect.
Now we just got to wait for him to wake up.
Let his leg down, take his rope off.
No, he's not bleeding. Okay. You can take it off, yeah.
Good job waiting, bud.
You got him just in case?
Yep.
That's it. He still has some nystagmus, so we're not there yet.
What's that?
So nystagmus, you can see the eye kind of moving back and forth like this.
Uh-huh.
It'll start to get like really, really fast
Uh-huh.
when they're waking up, and then it'll go away when they're fully awake.
So, and it's still slow.
He's still got a slow one, so we're not there yet.
Okay.
Hi, bud. See how fast that nystagmus is now? It's a lot faster than it was.
It's
See it?
waking up now. He's
Yeah.
gonna be, 'cause of the
Super wobbly.
Yeah.
Oh, it's like spinning circles in your
Yep.
eyes. One of
yeah,
the
it
veggies.
makes them just really dizzy. So
Yeah.
we try to hold these guys down as long as we can, just so that they are pretty good on their feet when they get up.
Yep.
We don't want them to be super drunk.
So in case YouTube hasn't figured it out yet, my wife works for Dr.Torvik. That's not the reason I use Dr.Torvik. She's been my vet for several years and a friend for a long time before that.
Too long.
Thanks. She's gone the extra mile for me and my horses several times.
No, you're a good client too. Kind of a pain in the butt sometimes.
Sometimes when bills are late, you know. Typical cowboy. So for the couple viewers I have that are around the Fallon, Silver Springs, Yarrington area, I highly recommend her. And if you're outside her range, sorry.
We don't travel that far.
Not anymore.
Well, price is right, you might.
Well,
I do have viewers in Germany and
well, yeah. Free trip to Germany. That'd be nice.
yep. All expenses paid, go geld one horse, go to Germany.
Oh, I'd have to get licensed in Germany.
Yeah.
Well, all expenses paid.
Well, theoretically, yes.
Mm.
So this episode, it'll post the day that this happened, which is Wednesday, the 10th of January. 8th.
Pretty sure today's the 8th.
8th. Okay, whatever. Anyways, YouTube will be seeing this the same day. Friday's video will be back to my normal day working, and that video will go back a few months. I think towards the middle of November. And then next Tuesday's video, I'll answer a couple questions that you guys have asked in the comments. Just to give you kind of how it's going.
Not yet, buddy. Easy, buddy. Easy, buddy. It's a good try. Okay, good try. Not yet, buddy. Not yet. That was a pretty good try, though.
He's bleeding. That's not concussion.
It's
Yep. Don't slam your head, buddy.
Nice catch.
fulfilling my prophecy as dead weight. Is this one? Yeah. So.
It's on this side.
Whoa, Trapper John, the
It's
world
like the world is spinning. You can see that nystagmus really well now, so we're coming out of it.
So it'll kind of just peak and then quit?
Yep.
He's having some muscle tremors here.
That's pretty normal.
Okay.
Let's just get your legs untangled from each other. You want it over underneath so that way when he gets up it's on this side?
Yeah, well, I kind of want on this side so I could stop him from slamming his head if he...
Get up nice and slow, buddy. There we go, buddy. Good job.
Hey, big guy.
A little bit of blood, not bad. That's a normal amount of blood. Good job, buddy. Oh, buddy. We're just changing panels around right now because there was some hay on the ground. And these guys you don't want to eat for up to an hour after anesthesia or any sedation because a lot of times they're not awake, they don't really know what's going on. And if they try to eat, they could potentially choke on something. And that's not something we want to do. So that's why we usually try to get them away from any hay or feed while they're recovering.
Is this water trough a problem?
Water isn't a problem for drinking, but it's more of a problem if he's going to fall into it if he doesn't have his feet. So we usually like to have him in an area with no water troughs or anything.
We'll
like
move
that.
the trough too.
But we'll make sure he's nice and awake before we let him go.
Yeah.
Let's take him for this short walk and see how well we have our feet.
Rush is like you're taking him? Well, it's very wobbly.
That's better than a lot of them. He's like, I'm sore. Don't spook, buddy. He can stand right there next to Rush if he wants. They're full brothers, right?
Yes.
Yeah.
They're all out at Battle River Inc. in Thule. What's the full post-treatment care for him?
So for any castration, I like these guys to walk, maybe a little bit of trotting starting the day after, and that's just to help promote drainage and keep swelling down. Cold hosing the area for about 10 minutes twice a day, and then usually anti-inflammatory, so like Butte for 3 to 4 days would be great.
Okay. What do I need to look for to where if I see it,
A little bit of swelling is totally fine.
Okay.
And that hole that I left open that I pulled the testicles out of should stay open for, I would say, about 5 to 7 days, just to allow drainage. If it looks like it's closing early and you're getting a ton of swelling through the penis, the sheath, then, you know, you're not walking them enough. Or if it gets really bad, I need to know about it.
Okay.
And most of these guys are back to normal in a week.
Do you recommend any kind of topical spray like a Shriners or Vetricin or anything like that?
Not usually. Just make sure the area is clean. If it was fly season, I would say definite fly spray, SWAT.
Okay.
But since we don't tend to have a lot of flies this time of year, then no. Just, and the cold hosing will help keep it clean too.
Yep. That's one reason I opted to cut him now, is it's not fly season. And with the way pigeon fever's been, if it was fly season, this would be just about
This would be
guaranteeing to
bad,
give him
yeah.
pigeon fever.
Yep.
Because contrary to what everybody thinks, correct me if I'm wrong, but pigeon fever is transferred by flies, not
Yes.
pigeons.
Nope. The reason it's called pigeon fever is a lot of times it'll cause swelling on their chest to where it looks like they have a pigeon breast.
Okay. But it has nothing to do with an actual pigeon.
No. Also known as dryland distemper.
Dryland distemper.
I think we're getting pretty close. He's walking pretty good. He's like, my life. What did you do? Oh, wow.
You gonna walk circles, bud?
Would he be better if Rush came in here and just stood with him?
He would be calmer. You want to do that?
Yeah, as long as Rush isn't going to run him around.
They play and stuff, but Rush ain't mean to him.
I think we're okay. We just watch him for a minute.
All right, so that's that. Trapper's gonna stand here in the pen by himself for a couple hours, and you see Henry's checking on him. Anyways, like I said, this is gonna post the same day. It's not my usual schedule, but that's all right. Hope you guys learned something. Like I said, we've been using Dr. Torvik for years. She's been awesome for us. If you have any questions in the comments, or any questions, please leave them in the comments, and anything I don't know, I will ask Dr. Torvik and respond to you. Anyways, we'll see you guys on the next one. Thanks for watching.